One of the major developments in thinking in Scotland in recent years has been the importance of recognising the impact of trauma on the lives of individuals within our society, and the need to ensure that we support individuals to overcome the damage that has been done to them by the trauma that they have experienced. That was all true before COVID. It is, in my view, reinforced and magnified by the impact of COVID. It's very clear to me in the work that I do as Deputy First Minister, as the Education Secretary, but also as a representative of people and communities in Scotland, that individuals have suffered significant trauma as a consequence of COVID. And we have to understand the importance of addressing that if we're going to support individuals to be able to overcome the impact of trauma in their lives. I don't want to have a situation where people who've experienced trauma, where they feel in any way blamed or punished because of the trauma that they have suffered. The duty on all of us is to help those individuals to overcome the impact of that trauma. And that's most effectively taken forward by making sure that we've got a trauma-informed workforce, that we put in place a trauma-informed training programme that enables those who are responsible for supporting individuals to overcome trauma to be well informed about how best to do exactly that. So I look forward to us continuing to build on what's been a really strong foundation of policy within Scotland in recent years, supported firmly by the Scottish Government, endorsed by our local authority partners, and it's crucial that all of us involved in this area of activity support this activity, taken forward by many of our third sector partners who make such a magnificent contribution to all of this work, that we all combine and collaborate to create an effective trauma-informed training programme for our workforce, so that where individuals present having experienced trauma, whether they're facing a local authority member of staff, or a member of our National Health Service staff, or somebody within the voluntary sector, that they are facing somebody who is trauma-informed and is able to help them to overcome the difficulties that they have experienced. That is a priority for all of us, a mission to make sure that we address the impact of trauma on the lives of our fellow citizens and support them to overcome those difficulties. That's what a trauma-informed workforce should do, and I'm determined to make sure in Scotland that we make that happen.